Want to talk about the Pitt, the TV show, for a second. I'm kind of in the middle of season two. I finished the first four episodes. It's still airing, so I couldn't really tell you everything that happens. But I watched season one maybe about 2 or 3 weeks ago, and it was really good. So I'll just kind of rant about the Pit for a little bit, I guess. Why not? Mostly off of memory because I kind of dropped it for about the last week or two. Um, but anyway, I really like all the characters in the show. And I also really like the, not that I know much about this medical shit, I don't really. But what I've heard about the show is that it's one of the more realistic shows in terms of the, actual diagnoses these people are, these doctors are making, the way they're speaking about uh, the patients and what they're observing, the way they're doing the procedures. There's some pretty graphic scenes in the show, so just put that out there. Like there is literal, there's a childbirth scene where you can see, the vagina and all that shit. Like it's a pretty graphic show. Like they don't really pull punches, right? In terms of because they want to be kind of I guess a realistic show. I don't know anything about the creators or the writers or anything, but I really like a lot of the characters, and I really like the concept too. You have both of the seasons take place when tragedies seem to occur or just like unforeseen events occur. The first season has well, spoiler alert, okay? The first season has a mass shooting event, and there's a whole lot of drama about this mass shooting event. They thought that maybe they had let the shooter walk off, and, there's a whole lot of stuff and uncertainty with that whole event. But, it's just, it kind of explores like what happens to the nearby ER when one of these terrible tragedies occur, and what do the doctors and staff go through, and of course what do the patients go through. And so that is like you don't really see this in media that much, because I think it was a very I don't know if I'd call it realistic, but it seemed like a genuine, some real lessons learned from. I assume that this show was kind of co-written with people who really know the medical field well. It's not, I don't think that this could be a passion project of somebody who just, happens to want to write a medical drama out of nowhere. But anyway, so a lot of these characters are really good. The main character, Dr. Robbie, he is, a very seasoned physician who, during COVID, lost his mentor. And I think that he was kind of directly somehow involved in that death, and he feels that he could have. He blames himself for the death of his mentor and probably one of his best friends on in the world, and so he kind of really struggles with because this also happens on the anniversary of that, which is just kind of a I think a convenient thing really. But anyway, so this doctor's kind of really he's pushing a lot of these feelings down because it's the anniversary of the death, and he's still he kind of is the encapsulation of the super high performing person who doesn't let their burdens kind of show through, and kind of he tries not to let those things that really should he should probably be in therapy, and I don't think that he wants to be stronger than all of that. He doesn't want to need all that, and he's still dealing with that in season two. They've kind of talked about how he's going to be leaving and he wants to go on a sabbatical, probably to get his mind right again. I don't know exactly how long between the two seasons, but anyway, Dr. Robbie just kind of is struggling to deal with it. At one point, things get so overwhelming for him that he kind of breaks down, and he kind of withdraws into a room and kind of is crying, and somebody sees that, but really nobody outs him for it because, again, as a high performing person, as a leader of the entire, he's the leader of the entire shift. He's the senior attending. You can't you have to stay on your game all the time. It's just one of those positions. Not that I am anything like this. This is really, but I was in a similar position for a lot of my career where there are people responsible for. I was never at the highest level, but there are people responsible, that I was responsible for. The size of the team would probably be about the size of the doctors and nurses that were, that I suppose Dr. Robbie kind of has purview over. And it's a really, it can be a nerve-wracking thing to be responsible for every problem your team faces and need a solution for every problem your team faces. And, in the medical field, I'm sure it's a little different because you can't solve every problem like a patient's going to die. It's inevitable. But anyway, so his character is in a very high up position, and it's a high stress position, and he's So it's just interesting to see how he handles it. Overall, I think he handles most of the conflicts very interestingly. I suppose that takes us into the conflict he has with Dr. Langdon, who is also a very interesting character. Because he is a guy who is, again, super high functioning. He's probably the second in command behind Dr. Robbie, and he's very good at his job. He's a very high performing doctor, but he has a problem. He is addicted to benzos, and he's weeding himself off by stealing from patients, and it's a really bad thing to do. Obviously, I kind of feel like what Dr. Langan goes through is kind of what I went through. I did some things I'm not supposed to do at work. I got into arguments with some of my coworkers that I'm not supposed to really have. I'm supposed to be their leader, and we kind of bickered more than. Anyway, I'm not going to talk. I don't know when I'm going to talk about why I was terminated. It's not as big a deal, but it's just a corporate looking out for itself. It doesn't really matter too much. But anyway, Dr. Langdon's one of these guys who is he starts doing the wrong thing at work, and it hits him. Dr. All of this is kind of crazy because this is the first day at work for like so many interns, and it's their first day at work. And it just, some of this shit should have happened over the course of months. All of the drama, it should have happened over the course of months. All this stuff is like way too much. Can you imagine being at work your first day and you basically make like enemies on your first day at work? No, you're just trying to get oriented. But anyway, the point is that there's a lot of interesting conflicts amongst all of the staff. I don't know every single doctor's name. Dr. Collins has some history with Robbie. She's trying to have a baby. She's struggling with that. There's the really young doctor who's like the daughter of one of the senior up nurse attendings, and she's a prodigy. She's genuinely a genius. She started attending college at like 13. She's 20 years old. She can't even drink. And, she is practicing medicine as a student doctor. So she's all things considered, she's just a prodigy. And it's interesting to see her growth in season 2, the little bit that they've shown. She's kind of really coming into her own. And she's very talented, and it's just kind of, but she's a little awkward, and she has a little bit of, she doesn't want to be like viewed as nepotist, a nepo baby because her mother's high up, and it's just interesting. I feel like the characters are very human. The things that they feel are very interesting. You've got the Huckleberry character. I forget his actual name, but that's what I think Santos calls him all the time. And again, both of these guys met on their first days, and this guy's basically just like the nerd, and he's also got some kind of stuff going on. He doesn't have a home. And Dr. Santos eventually actually extends at again, this is all spoilers. At the end of the season, he kind of has the opportunity to move in with Dr. Santos, even though she's kind of been picking on him all day. But at the end of the day, she kind of extends that very, very human offer to him, and that he's just been like sleeping upstairs and showering in the sink and all this shit, right? He's bumming it because he's broke, and he's got a lot of student debt, and he's got no income because I guess these doctors don't get income. I don't really know how this shit works. But it sounds like he doesn't really have income. And in the second season, he's talking about how he got his first direct deposit, so maybe that's the case. I don't know anything about that. But all in all, a very pure-hearted guy, just trying to do a good job. And he gets, dude, that character's so funny. He gets like puked on and pissed on and fucking all this shit. The first like 5 episodes, he has to change clothes because he gets so fucking soiled multiple times. And then eventually they kind of stop picking on him that way. I thought that maybe the writer was like, we can't just make him keep getting pissed on all fucking day. But all in all, just a kind of a pure-hearted, happy-go-lucky type of character. He's a good guy. Dr. Santos is kind of this, she's a talented doctor, actually very talented from what it seems like, but she's not a people person. She kind of butts heads with everybody around her. People are not liking her. She's getting into fights with like everybody, like little ones, just kind of, she's just not likable. But all in all, she is a good person. She's just not very likable, and that's kind of her struggle. That she's a good doctor, and she really wants to be. She's kind of aggressive about it too. She wants to like give me recommendations to get into this program. It's her first fucking day on the job. You know what I mean? Like she's just kind of over the top in this way. But it's still like people are like that. She's a go-getter. She's trying to get out for herself. She doesn't care if she makes friends along the way necessarily. There's the head nurse. I think she's very important to talk about. I'm glad she came back for season 2, but she's basically been doing this basically her whole life. She's got like 33 years on the job, and none of this shit really phases her until today. At the end of the season 1, she's really struggling with all the shit that's going down, and she really thinks that it might be her last day. But she's basically, I'm sure if you've ever been in a hospital, some of these super seasoned nurses, like they've seen it all twice. They don't care. Just fucking listen to them because they know what they're talking about. She is that character. She is fucking mama, mama nurse. She knows everybody. She knows everything. You can trust her. And so she's just a good character. I don't really have too much else to say other than, I really respect people like that who just can, who really just kind of are the soul and structure of these places, really. The nurses really run the show a lot. Obviously, these doctors are portrayed to be extremely high functioning, extremely good, but like nurses really do a lot of the work in a hospital. I've been told they do most of it. So anyway, the nurses are really good, and there's a couple more nurses to speak of. I won't speak too much on maybe the rest of them. Anyway, but overall, I really think The Pitt is a very interesting show if you're looking to watch it. You're going to find some very interesting character pieces. You're going to find a lot of interesting medical, there's just a lot of funny, interesting medical situations and things that occur in the show. It's highly, highly dramatic, highly interesting, highly fast paced. It's a fun show to watch. It never really kind of gets slow. And I think you'd have a good time watching it. So there's The Pitt.